Welcome to this edition of Healthy Living. I'm your host, Tim Kelly. Today's topic is the Suffolk Partnership for a Healthy Community, and it's really special because we're talking about the 15th anniversary of the partnership. And joining us for the first segment on today's program, we have Virginia Savage, who was the first president, I believe, of the partnership and also a board member, and Ross Boone, another board member with the partnership. Thank you both for being with us today.
Thank you.
Thank you for having us.
Let's roll back the time clock a little bit and talk about what got the partnership going. What was the impetus to form the partnership? And back when 15 years ago, what was the thoughts behind bringing this everything all together?
Well, I was a nurse at the hospital, and we had started an outreach program, so we were going out into the community to really determine why people kept coming back to the hospital again and again and again. And we found lots of reasons for that. Medications were not available. They could not access those. There were lots of gaps out there in the community. Bobby Chapman and I actually talked with Mr. Giermack, who was the administrator of OBC Hospital at the time, and went to see Pat Winters at the health department. This is long before the OBC Healthcare Foundation,
right.
So there was none of all that's going on now available then.
Yes.
At that point in time, it really was sort of the hospital and the health department that was concerned with the community health in Western Tidewater. They were very, very interested in forming a community coalition. And I believe in 1998,
That's correct.
We had a community forum to see how much interest there was. And this was a cross-section of the community, the organizations, schools, any organization, the city. We had 60 people who attended this breakfast. And Pat Winters did a presentation on some of the gaps in the community at that time. And you were there.
Right, and what came out of that was the fact that it was obvious that there was a need.
Right.
And who would fill that need? And thanks to the work of Virginia and Bobby and others who were a part of that original group, they came back and they sat down and put their heads together and said, we can do something about this, along with the persons that she's already mentioned. That committee went back together, that small group of ladies who we are totally indebted to, went back and decided that we can make this happen because there was such a positive energy as a result of that meeting that they just came back and they were all supercharged up and ready to go. Well, as a result of that, they started their movement to say, where do we go from here? So a strategic plan was in the making. They had to develop such a plan. As a result of their planning, as a result of their continued activity, as a result of their energies, as a result of the community's positive response under the big umbrella that the partnership was trying to create right now on paper, with a lot of little things in between, we are today flourishing in the community. I still think we are not well known as we ought to be in the community, but we have a strategic plan in place, we have a mission in place, we have goals in place, and we have some successes that we can point back to as a result of the fine work that Virginia and her, I call it Virginia and her crew, and sometimes I refer to her as the mother of the Suffolk Partnership for a Healthy Community.
Well, I think one of the key things that was mentioned is the fact that when everyone came together on that initial meeting, it was a common goal. I mean, everybody, Ross, I think as you said off camera earlier, knew what the problem was. It was a matter of figuring out, and I think that kind of bred the success that we've seen that the partnership has been able to develop. Would that be accurate?
That would be accurate. That initial group, though, the steering committee, even before it became the partnership, because we didn't have a name at the time, believed very strongly that what we had to create was a structure and a process that would invite people to come with all of their ideas, and they would be welcomed, and we would see how we could blend it all together to make a healthier community. And I think we have been successful.
Absolutely. And I think that the initial focus was that everyone is under the tent, and everyone has a say, and everyone is on equal footing.
Right.
That idea and that feeling caused this partnership to blossom. It really did, because everyone felt like that they were just as important a contributor as anyone else on the table. Sort of like we threw off all of the titles, we threw off all of the organizations that you may be a part of or you may be representing, and say, look, this is about the community. And the focus is on the community. How can we make our community a more healthy community, and at the same time bring together these diverse persons with diverse interests, but
Yes.
a common interest
Right.
in the fact that we need to make this community, Western Tidewater, Suffolk in particular, a better community for all of the citizens. And that's where we are today, still working at that goal.
And I think if you look at the board, the makeup of the board as it currently exists today, all the private, public, you have students involved. I mean, it's a really good cross-section of the community that really, if you're trying to achieve goals, trying to have successes, I think that's a great philosophy to apply to it, to bring those folks together to the same table to discuss and move everything forward.
You're 100% correct. I mean, what can I say after
Right.
that? Virginia could say, you're absolutely right. And I think we're unique in that sense, that this is I don't know of any other organization in the city, in Western Tidewater, that attempts to do what we try to do in terms of making sure it's all inclusive, and we invite persons right now
Right.
to come and be a part of what we are about, as demonstrated by the successes we've had with some of the ongoing programs and some of the programs that are in the pipeline. Because we did not try to take over anyone else's program.
Correct.
See, and that makes a difference. What we would say, how can we improve on the wheel that's already been invented?
Right.
In our case, it was that we're going to not invent a wheel, we're going to see what wheels are out there and how can we bring those wheels together to maximize the effectiveness of what's already going on. And again, I go back to the original planning group.
Correct.
Because of the positive nature of what happened there and the will and the desire and the strength of those ladies. You notice I keep saying ladies.
I understand.
Those ladies who were involved in that initial piece of
Right.
work.
Now, I know one of the terms used when we refer to the partnership is a coalition building organization. If you could talk about the philosophy, and I think we've kind of already been talking about that, about bringing all these parties to the table, but just talk about how that philosophy has really impacted the partnership and all the great things that's been able to be accomplished over the last 15 years.
I think one of the greatest accomplishments of the partnership was actually the creation of the Western Tidewater Free Clinic. I think that the fact that the partnership actually did start the clinic is a fact that
Right.
has been forgotten, because it is a freestanding, and that is what it was intended to be.
Correct.
But we started that just like we started the partnership,
Correct.
which was a community forum. And there were over 150 people who showed up at that forum.
Right.
And from then on, everybody, it was just amazing to see the enthusiasm, the energy. Everybody knew that it was a great, huge need for Western Tidewater. So it was a thrilling event to be present at, and I think very historical for the city of Suffolk.
Indeed. And I think that the fruits of that early labor are really, like you said, you talk about the free clinic. As you noted, it didn't exist before the partnership did. So that's a definite derivative from this organization. And Ross, any thoughts on that same comment with the coalition building philosophy?
Well, I think that the key has always been partnership. And the key word is partner. And the second word is coalition of various groups in the community to bring about a change that we believe is very important. People bought into it, and they have been working at it ever since. I happen to be on the board of the Western Tidewater Free Clinic, and I know that's the beginning of what we are about, what these ladies and what that initial group put together that says we need this in our community. And it's been very successful. As a matter of fact, it's another thing that's in our community that has made this a better place for everyone to live. If you were to come to some of our board meetings and you kind of listen to some of the stories that we have, I mean, it's heart-wrenching.
Right.
I was unaware of a lot of the things that I have learned as a result of being on the board. But that works also with the partnership as well as the free clinic. But the free clinic is not the only success. It's probably the most visible
Correct.
success that we've seen. But our 5K, which we just concluded,
Right.
is another example. Our work with looking at the whole area of obesity and diabetes, another thing that's ongoing, the relationship with the religious communities in our greater area. And so, and as you mentioned, bringing in students who are part of our community. I mean, it's just a wonderful kind of place to be. It's an experience that you'll never forget, and you feel like you're giving back to your community because you are a part of this community. So it is of the city, both at the same time. It is the city and it's of the city, and that's what we encourage people to do. And that's why we are celebrating part of our 15 for 15 program, which I won't kill anybody else's little piece at the end. But that's why we had to
Right.
celebrate. I mean, we
Indeed.
have something to celebrate,
Indeed.
and we want as many people to be a part of this as we possibly can get.
Okay. Well, thank you both for sharing again with sort of the beginnings of the partnership, bringing us kind of to where we are today. And I think the next segment we're going to be talking about exactly that the 15th year anniversary and what's going to be happening this year moving forward with trying to really push this project even further into the future. We're joined now by Robbie Lawton, the Executive Director of the Suffolk Partnership for a Healthy Community. And if you would talk about the fact that the partnership, the mission, the goal is not done. There's still work to be done and work that's ongoing. If you could just talk about the fact of where the organization is heading.
Okay, well, thank you. Sure, we do have a lot of work still left to do, but the accomplishments from the past have been phenomenal.
Mm-hmm.
I have only been with the organization for about 10 months.
Okay.
But I am so impressed with all that has been accomplished through the great leadership of all the past people like Virginia and Ross and Caroline Martin and Bobby Chapman and all those. It's been tremendous. The partnership is focused entirely on health initiatives and how we are going to try to improve the lives of all of our citizens here in Suffolk. And our theme sort of is that healthy lifestyles plus, as we can see up here,
Sure.
healthy partnerships
Right.
equals a healthy Suffolk.
Correct.
And so the lifestyles that we're trying to promote is trying to improve the lives of all the people of Suffolk, whether it be their mental health, their physical health, their socioeconomic health, or their spiritual health. This is what our mission is of the partnership. And so that's what we've been focused on, and that's what we continue to focus on. The other side of that is the partnership side, which Ross and Virginia earlier had talked so eloquently about. It takes both.
Right.
It takes us focusing on what is going to improve the health of the people of Suffolk through changing behaviors, changing risky health behaviors to healthier behaviors,
Right.
and how we're going to promote that through all of the organizations that we have as our partners and as our coalitions and all. We have a tremendous task ahead of us, Tim. We have a huge task and a huge challenge, but we feel like we're really up for it. We have all the pieces in place. We have a tremendous board that is extremely active in all of aspects of our programs and our activities, and we have a community that is ready and willing to make some changes. We've seen that very recently. At our 5K this past weekend, over 800 people pre-registered for that event. So that shows us that the interest is there for people to make those changes that are going to improve their life. The statistics here in Suffolk are alarming. 2/3 of our adult population is considered overweight or obese, and 1/4 of our children are considered overweight or obese. So we do know that those statistics are showing us that Suffolk is above the state average in so many health issues, chronic diseases, heart disease, at risk for diabetes, at risk for hypertension, those type things. And as a community that cares for the people that we are serving, that is why our focus has continued to be on improving those healthy lifestyles and getting people to make better decisions on what they eat. One of the things that I wanted to mention, because I think it's a real important step that we've made here in Suffolk, when we talk about the community's involvement and the community buying in to our message for living healthier, we were so pleased that the city of Suffolk recently adopted our resolution for Healthy People, Healthy Suffolk to help us in our promotion of our programs and our activities to encourage all the citizens of Suffolk to, be more active in how they are seeking to live a healthier life. And so that was a really tremendous opportunity that the city council and the mayor and the city manager have given the partnership by adopting that resolution. So I just wanted to let you know and everyone else know how appreciative the partnership is of adopting our resolution for Healthy People, Healthy Suffolk.
Now, I know certainly when we're talking about all the programs and things, it's definitely a combination of education as well as resources. I think tying those two together, as mentioned earlier, there's a lot of great resources in the community, but it's also the education component to realize how to tap into those as well as what to do. And I think you mentioned it earlier about the fact that it's not only reaching out to the individuals, but having those individuals kind of spread the word of being healthy and trying to achieve and pursue a healthy lifestyle, correct?
Exactly. And our partnerships that we have with so many key organizations throughout Suffolk is where we get a lot of our promotion through health education.
Right.
The partnership has wonderful people on its board, has good staff and all, but we don't try to say that we know everything about every subject. But we are able to pull in so many wonderful partners right here in Suffolk that join us because we're like-minded in our mission.
Right.
They have the same mission that we do for improving people's lives. We have great partnerships with the American Diabetes Association, American Heart Association, the Alzheimer's Association, American Cancer Society, and many, many health agencies through Centera Obesity Hospital, through a lot of things that come out of the Western Tidewater Free Clinic, and many other groups that have joined us in sharing our mission. And so we're able to really put a good foot forward when we talk about health education and health literacy in Suffolk by bringing all of these wonderful partners to the table with us because we share that same vision.
Now, what are some of the pathways to a healthier Suffolk? I mean, what are some of the ways to get from point A to point B in that respect?
Yeah. Well, let me talk a little bit about the programs
Sure.
that we have going on. We have several different programs that we are working to encourage a healthier lifestyle. Our biggest initiative was a partnership that we came with Obesity Healthcare Foundation about 2010, I believe, forming Healthy People, Healthy Suffolk. This is a 10-year initiative. We say long-term. It's probably going to be much longer than that. As I've heard many of our board members say, this didn't happen overnight.
Right.
This obesity issue did not happen overnight. It's not going to be cured overnight. But some of the steps that we have taken to help maybe push that along, make people a little better educated about it and all, goes through our Healthy People, Healthy Suffolk initiative. We ask the community to help us get involved by joining work groups where they actually sit down at the table once a month and we talk about what are the needs, we talk about where are the gaps in health care, we talk about what problems there are that our people are affected by, both young and old. And we try to come up with programs, projects, initiatives that help promote that so that people can find a niche somewhere that they can get involved in that would help promote our mission and our vision. So Healthy People, Healthy Suffolk through Obesity Healthcare Foundation as our main funder of that has been our largest initiative in combating obesity, both childhood obesity and adult obesity. We have another really active program that is called our Suffolk on the Move. And the Suffolk on the Move program highlights the importance of physical activity and how important that is in our daily lives. I have heard the Surgeon General state many times that exercise is probably the single most important thing that people can do to improve their life. And to take that one step further, walking is probably the simplest form of exercise that most everybody can do. It's free, it's usually accessible to most everyone, and most everybody can do that. So that's why, from a physical activity perspective, we promote walking events so much.
Correct.
We also promote biking events, and we promote events for senior adults like Wii bowling tournaments.
Right.
And then we also even promote smoking cessation classes through our Suffolk on the Move initiative. Another initiative that we have that we're very proud of is our community gardens. Currently, we are in 8 different communities in Suffolk promoting gardens, and we're in 8 different schools in the Suffolk public school system promoting gardens.
Right.
Now, these are both an education standpoint, but they're also a physical activity perspective where people actually can get out and work the garden. If you've ever done any gardening, which a lot of people in Suffolk have, you know that there is work involved.
Definitely.
And it does wear you out.
Yes, sir.
And make you tired. So our gardens have been really, really instrumental in promoting both healthy eating and active living in Suffolk. So we are really excited that the school system and the community has bought into the importance of the community gardens, and we're able to give back to the communities. They give us their volunteer hours by helping in the garden and growing the product. But once the product is harvested, it goes back to the community, to different groups that need it, the indigent, the older population, churches, the food pantries, those type things that we give back. And then our fourth program that we promote for improving people's life is our Positive Lifestyle Commitment Program. And this is a year-long program that people commit to, where they do a self-reported health risk appraisal. We provide blood lab work for them to get their numbers, and I encourage everybody to know what your numbers are, your blood pressure, your cholesterol, your blood sugar, your A1C numbers, because that's critical in knowing what you are at risk of from a health perspective. And then we help them set goals for their own personal behavior changes, lifestyle changes, and we give them web-based technology and web-based education that they can help themselves work through their goals, and they get points as they work from the beginning, what we call their baseline number, up through the year-long program to increase their points so that they are learning and improving their health risk.
Okay. Now, is that something that's accessible through the partnership's website?
It is.
Okay, good deal. And of course, we'll have that website address and a contact phone number up on the screen several times throughout this interview, this program, so that way people know how to get in touch with the partnership and find out how to tap into the resources we've been talking about today. And of course, one of the reasons we came here today is the fact that we're recognizing the fact that it's 15 years that the partnership has been here in the city of Suffolk. So what is planned to celebrate the 15-year anniversary of the partnership?
Well, we're continuing to move forward with all of our programs. I believe, as Ross mentioned earlier, we've got new initiatives and new programs, new projects that we want to implement. But with anything that is worthwhile, it takes resources, financial resources especially. And so we are promoting this 15 at 15 campaign to celebrate our 15 years by asking every citizen that is able in Suffolk to give $1 for each of those 15 years. If they can give more, $10 for 15 years, $100 for 15 years, would be fantastic.
Sure.
But this campaign is just continuing to promote the awareness of the partnership, the awareness of the need to improve people's lifestyles by changing their health risk behaviors, and joining us in helping us to make those happen, to move those forward. As with all of our partnerships, together we can accomplish much more than we can individually. And so if we can get everybody in Suffolk to join us in our 15 at 15 campaign, we would be able to reach most of our goals. We'd be able to put out more programs. We'd be able to involve more people to come in and have a better understanding of why it's so important to live a healthy lifestyle, whether it's by making healthier food choices or whether it's getting more physically active and then getting engaged with their family, their friends, their neighbors, and their churches, and helping to push a healthy Suffolk out there so that in 10 years from now, we can look at each other and say, thank you, pat everybody on the back, because we all had a part in making that happen.
Indeed, indeed. Well, again, 15 years of the Suffolk Partnership for a Healthy Community, a great resource in the community that is continuing to grow and develop. I want to thank everyone for being with us today to talk about this great partnership and all the great things that it's able to accomplish and is continuing to accomplish. And again, the 15 at 15 campaign is off and running.
Yes, it is.
And again, accessible through your website as far as to get tied into that. Is that right?
There are many ways to get involved through the website. We have brochures that we're hoping to distribute all around Suffolk that they can mail in or bring back to our office, or we even have board members that will take their donation from them and turn it back into us.
All right, well, again, a community out there working for you there. And again, that'll do it for this edition of Healthy Living. I'm your host, Tim Kelly. We'll see you next time.